Yeah, so as I said, my name's Toby Speare and I'm a pharmacy academic at the Centre for Remote Health. We're based in Alice Springs, and if Debbie thinks she's an imposter, I feel like a bit of a fraud in this setting. So before I begin, I would like to acknowledge the traditional owners of the land on which we meet, so the Wiradjuri people of the Kulin Nation. Pay my respects to their elders past and present. So in this brief discussion, I'm going to highlight some of the activities that we are undertaking at the Centre for Remote Health that are striving to improve the quality use of medicines for for the primary healthcare clinics in remote Australia. So, just to give me a bit of an idea of who I'm talking to, would you raise your hand if you're from a rural or remote area? Perfect. Well, what about if you've worked in remote Australia? Oh, fantastic. So, as I'm sure you'll appreciate, nursing in the remote context is a unique undertaking. So remote area nurses are often described as specialist generalists, meaning that they need to know a little bit about a whole lot to care for patients across the lifespan. So from infants through to older patients, and they're specialists in the delivery of healthcare in remote areas. So nurses are recognised as forming the backbone of rural and remote primary care, and they deliver a growing volume of services, particularly in relation to management of chronic diseases. So while the bulk of nursing activities in remote areas is primary health care, remote area nurses do have to manage acute situations, often involving many members of the same family within a culture and a community that is not their own. They do this in a collaborative manner, in a resource-poor environment. That means they often have to take on the roles of other professions. So they're often acting as the driver or the cleaner, performing the role of pharmacists and also of social workers, and commonly caring for animals too. So remote area nurses practice at an advanced level with distant medical support and limited pharmacy support. This extended scope of practice requires nurses in the remote context to have a broad knowledge base in relation to disease management, and it includes the administration, the monitoring, individualisation, supply and storage of medications. So this advanced role necessitates additional education and training. So in 2003, recognising a dearth of appropriate training for remote area nurses, staff at the Centre for Remote Health developed a course in disease management called Pharmacotherapeutics for remote area nurses. So the safe and appropriate use of medications can have a huge impact on a person's health and quality of life. When it is done well, it can have amazing effects on a person's well-being. But when medications are used poorly, they can lead to significant harm and death. So the use of dealing with medications is a very complex and tricky exercise. But the use of medications can be thought of as an experiment. And like any good scientific experiment, use of medications should follow a standardised methodology based on sound evidence with a process of verification incorporated. So the Pharmacotherapeutics course is designed to assist participants in developing the knowledge and the skills in the clinical reasoning process to determine the appropriate use of medications. Now, the end of this clinical reasoning process should be the quality use of medicines, which means that medications are used in a judicious manner so that they are only utilised when indicated. The appropriate use of medication so that when a medication is deemed necessary, the correct medication is chosen, taking into considerations factors such as the condition being treated, the risks and benefits of the medications, the duration of treatment, the frequency, and also the cost. So cost to both the patient and society as a whole. That medications are used safely and effectively to get the best possible results, and that it ensures the efficacious use of medications, which means that medicines are used to achieve treatment goals by delivering beneficial changes in actual health outcomes. Now, the Pharmacotherapeutics program originally involved a 2-day face-to-face workshop with associated written assessment. In 2014, the Centre for Remote Health conducted a survey of all participants who had completed the course within the last 2 years. The results of this survey told us that overall participants liked the course and they thought it was useful, and said that it improved their knowledge, particularly in relation to the legal and legislative requirements, the clinical decision-making, medicine's review process, and the risks associated with medications. So feedback that we have received anecdotally and via the survey informs us that participants feel the course is valuable and rewarding, but it is very challenging and takes a lot of time and effort. The participants told us that the course could be improved with an online component. However, they were wary of this and stated that it would require additional educational support. So, heeding this call, the Centre for Remote Health undertook a consultation process with a variety of stakeholders, including state and territory departments of health, Aboriginal medical services, workforce supply agencies, professional bodies, and nurses who had undertaken the course. So it was identified that access to the face-to-face course was a significant and costly barrier. So the Centre for Remote Health then committed to developing an online version of the Pharmacotherapeutics course. So to do this, we convened a reference group of representative stakeholders to set standards, determine appropriate content, assessment and processes, and establish expectations for an online course. The draft course underwent an extensive review process with the reference group and a pilot study with experienced remote area nurses. So the resultant self-paced online course encourages clinical reasoning, knowledge development, and the use of those recommended evidence-based information sources. And this was launched in October 2015. So the online course comprises 8 modules that are designed to be completed over a 9-week period. The initial modules of remote context, principles of quality use of medicines, and also those pharmacological principles form the foundation of nursing practice in remote settings. The subsequent clinical modules introduce the practical use of medicines in the management of specific clinical conditions. So the pharmacotherapeutics course is based on adult learning principles. New concepts are introduced gradually with activities associated with them to provide opportunities to apply these concepts and principles to practical situations such as clinical scenarios and problem-based learning. Interactive activities such as the discussion boards and also the online webinars are conducted regularly during the course and provide provide the opportunity to interact with the content and also develop collegiate networks. So the interactive, so 3 webinar sessions are conducted during the course and provide participants with the opportunities to interact directly with the course coordinators and also with experts in elements of remote health. So in the 3rd webinar, I invite a guest lecturer who is an expert in some element of remote health to deliver the session. So far, we've had a public health physician who is a specialist in parasitology deliver a session on strongyloidiasis. We've had a psychiatrist deliver a session on talking with Indigenous clients about mental health. We had a occupational therapist run a session about how to manage dementia in remote Indigenous communities. And next week, I've organised for an endocrinologist from the Baker IDI Heart and Diabetes Institute to conduct a session on clinical inertia in diabetes. So all of these interactive activities are provided or are available in both synchronous and asynchronous forms. So participants can attend the live events or they have access to recordings that they can watch at a later stage. Now, I encourage students to interact with these webinar sessions through the discussion board forums. Now, there are 2 types of assessments in this online course. So knowledge is assessed with multiple choice question quizzes following each module, and clinical reasoning is assessed with an interactive case study. So these automated assessments incorporate immediate feedback and which provides advice on recommended resources and also extended readings. And they are intended as a learning activity within themselves. So this is just a sort of a screenshot from the interactive case study displaying some of the feedback that is provided. So as many of the participants who undertake this course are located in remote areas with variable access to the internet, all sort of activities and content is also provided in offline format. So I upload all of the learning modules as PDF documents that participants can download when they have access and then read at whatever time they want. And if necessary, I provide them with the assessment items as Word documents. So at present, the online course has been completed twice with 65 participants in total. Now, a further 75 participants are enrolled in the current course, which commenced in April. Generally, the participants are fully employed, mostly with Aboriginal and Torres Strait Islander health services or with government departments of health, spread all around Australia, including remote Indigenous communities. So feedback from the participants who have completed the courses so far informs us that mostly participants think highly of the course. They find access easy and navigation is not a problem, and that the content is pitched at the appropriate level. So a surprising finding from the online course is the number of nurses based in urban centres who are undertaking this course in preparation for going remote. Now, this has always been a feature of the Pharmacotherapeutics course, but what we're finding is that the majority of people who are signing up to this course are based in urban centres. Now, it's a really positive outcome because what we're finding is that the experienced remote area nurses are providing guidance, mentoring and collegiate support via the online activities. And to those nurses who are new to the remote context. And this has great implications for the safety of both the nurse, the health services and the remote communities to whom these nurses are going to be providing care. So another surprising finding is the reach of this course. So in the current sort of edition of the course, we've got participants from every state and territory apart from the ACT. We've had a couple of participants complete this course while overseas. So one person was visiting family in Nepal and another guy was undertaking a tour of duty in Afghanistan. Now, quite a few primary healthcare nurses are undertaking this course for their professional development, which has been really positive. And we have had a few health professionals who aren't nurses also sign up. So we've had a couple of pharmacists and also a paramedic, and their feedback has been quite positive too. So, where to from here? So while this course is still in its infancy, it is subjected to a process of continued evaluation. So content, processes and assessments are regularly updated to ensure that the course is meeting the needs of nurses, health services and remote communities. Now, the development of this course has presented a number of exciting opportunities. So one is the development of a refresher course, which will build on the knowledge gleaned from the first course, or the adaptation of this course for other health professionals, including Aboriginal and Torres Strait Islander health practitioners and workers. So in conclusion, my vision for safe and high quality care in remote Australia involves a primary healthcare workforce that are highly educated and skilled in the management of medications within their individual scope of practice. Now, I see the provision of quality education and training that is both accessible and affordable as instrumental in achieving this vision. So if you'd like any further information about this course, there's the contacts. Thank you.
Thank you very much, Toby. That was very informative and very interesting, and what a big project you've embarked on. I don't know when you sleep, but anyway, thank you very much. Oh, and you've got two boys. We're taking questions for Toby. Just a moment till I get the mic to you because we're recording the session. Is that okay?
Hi, I'm Andrea Morello from Flinders University in South Australia. Just a question around evaluation of the outcomes. Any practice implications, so medication incidence reduction or expansion of scope of practice evaluation?
So because this course, it is very new, we do, like I am intending to do this. Though part of the challenge is in evaluating this course, in affecting change, is there's so many factors that influence that. Though this is something that's going to happen in the not too distant future.
2 seconds, we'll record your question if that's okay.
In regards to that, I'm Helen from Department of Health, Central Australia, Primary Healthcare or Remote Nursing. With all our medication incidences, we do assess and recommend or review when any of our staff have done this course or when they're next due to do it. and follow it up with our remote pharmacist as well.
Thanks, Health.
Thank you. Any other questions? No? Thank you very much,
you.
Toby.